Hello, everyone. Welcome to today's episode of the Daily Sip. It's been quite a morning already. I've had 3 conference calls, all very fascinating and still digesting some of them. One around tourism and disability, one around larger business and technology and disability. So it's been a cracking morning. And we're moving into a very equally interesting and very vitally important topic now. So I've got Ian Gargan, who's calling in from London, but also originally from Ireland. So welcome and thanks for joining, Ian.
Thank you, Martin. Lovely to be here. Thanks for inviting me on.
Pleasure. And so, yeah, I think it'd be great if you just kick off with framing it a bit about you, and obviously a little bit around Mental Health Awareness Week for people watching would be a great start, I think.
Yeah, thanks, Martin. So my name for everyone watching is Ian Gargan. My background is as a psychologist. Became a psychologist many years ago, and then went on to study forensic psychology, train in Australia, and then came back home from Australia and studied medicine to become an orthopedic surgeon. But practiced and registered as a practitioner psychologist and a doctor for many years, and very keen to interest in studying the relationship between mental and physical health. And then set up a practice in 2009 in Dublin, and replicating that service hopefully in the UK at the moment. And that's called Imagine Health, and really was set up with the vision that there would be access to mental health support and well-being support for anyone who wanted, individuals who wanted to contact us, but also for corporates and works in smaller businesses, so that they could get training or get some insight and support on how they can empower their employees and build a culture where there's a lot of scope for conversation about mental health and well-being, which was very I suppose very new, or a little bit original back in 2009, but very thankful to say that times have changed and mental health is on the tip of everyone's tongue now, and seems to be far more inclusive. So it's a much more open forum for discussion now. And even though it's Mental Health Awareness Week this week, and we love that week and want to use it to talk to people and support them.
It's every week, right?
It's every week, really. Yeah. And it's even more pertinent at a time when, 1 in 5 people, or 1 in 4 or 5 people might have a mental health challenge, whether it's poor sleep right up to depression or anxiety, schizophrenia, whatever that may be. But even now, I think that the statistics would show that there are even more people affected and mental health being slightly challenged because of the coronavirus and our isolation. But we can talk more about it today. But I always like to talk about mental health more about how to promote and optimize it, rather than actually how to deal when something's wrong with it. So just like you would your health, in terms of being fit and well most days. Yeah.
Sort of proactivity, not reactive. Yeah.
Exactly. Yeah. So, and there's lots of ways in which we can do that, and we can go through that today. But there's having your mental health toolbox about what's important to you, what makes you happy and empowered, and knowing what are the normal things that and what are the pillars of good mental health, which really are founded in exercise, diet, sleep and socialization. So big point I'd be making today is that we're physically distancing maybe at the moment because of the coronavirus parameters, but we don't need to socially distance. It's really important that we socialize. We can socially interact like we are now, on the phone, writing an email or a letter. I think going back to the physical mental health relationships, oxytocin effectively is the chemical that's secreted when we socialize with people, and it makes the good mood chemicals work better, like dopamine and serotonin. And no more is oxytocin that more concentrated than it is with a mum just after she's had a child, and it's thought to bring the mother and baby together and facilitate attachment, which is massively important for our confidence and identity later on in life. So you can see how, even though we might be reluctant, we're getting a little bit institutionalized and we're stuck in our home, it's absolutely vital that we can meet up with someone at a distance, like we're allowed to do at the moment in some ways, but even just a phone call or a small like text to someone, any type of social interaction bolsters those good mood chemicals and makes us feel a little bit better about ourselves.
Yeah, it's really interesting. Obviously we can weave in some elements of your journey, sort of from starting up, what you're doing and why you did it, and I think that would be something we can come back to. But while we're sort of mentioning now and the COVID-19 situation, we might as well start there. I think, so you mentioned about the social interaction and people are worried that they are going to be isolated from, exactly as you've just said, the problems of the mental health. But then when we've got the video software, and I saw on BBC News, actual letter writing has had a resurgence, that people are sending more letters, and it's not just out of some practicality. It's just that whole process of writing letters with your hands is a feel good factor, and it almost sounded quite like what you were just describing there as well.
Yeah. So I think social journaling and writing something. So it's actually probably rooted in mindfulness. So at the moment in COVID or coronavirus and the parameters we're working within, and important to people to know, to be optimistic, not to put themselves down. Everyone doesn't have to be becoming a yoga specialist or learning a new language or baking cakes every day. We're actually doing an awful lot by following the lead in trying to distance, so that we negate the spread of the virus. So people are actually being very active by remaining in their homes or remaining within the parameters, more than they should give themselves more credit for that, really. But also, and I'd also say even a lot of businesses are even more busy than we usually are, because we're having face-to-face meetings as well as doing our day job and getting through being productive. So it's actually, juggling work is difficult, and you might be at home as well with screaming kids and various things going on, so that's also a challenge. But important to know when we're in isolation or quarantine, the difference between, loneliness is just it's an interim, temporary feeling of distance from someone else. If that's anxiety, then that can lead to anxiety, and anxiety is like physical reaction to an environmental stimulus that's a bit outside of our control. Now, about 2 or 3 months ago, this seemed far more outside of our control than it does now. It's becoming a little bit more normalized. But you can watch out for things like palpitations or social withdrawal, or even though we were meant to have a phone call or a Skype or whatever, we decide not to. So we become socially apathetic. And then anxiety and depression can often exist hand in hand. They're bedfellows in over 70-80% of cases, and about 1 in 5. They're the most common forms of mental health challenge, and they're absolutely treatable. And depression is where it becomes a little more sinister, that you don't want to do the things you normally want to do. The anxiety is now becoming a kind of tiredness and pessimism, and you have this fear of impending doom, and you're socially withdrawn. So that might need you to have a conversation with a friend, or use an app to become mindful. And that goes back, or a clinical professional. If you're feeling really low, absolutely contact a clinical professional as soon as you can. But going back to the original point, and the positive side of it is, mindfulness is one of the, as well as various other apps that you can use, very useful for us to get in the moment, absolutely pay attention to ourselves and know how we feel, which is actually much more difficult than you think. So we nearly all experience it when we're studying for exams, say in college or school, that you become so focused on something, everything else doesn't matter. But we rarely become that engaged. And it's hard for us to do that in a given day. And I often say to people, when you listen to your favorite song on your phone or whatever, and you say, "Oh, I love that song, I'll play it again, I really want to hear it." And then you're about 2/3 into the song and you realize you've already started drifting. You're thinking about the shopping or what you're having for dinner, or finances, etc. And it's because it's actually takes a lot of effort to be in the moment and maintain attention, and mindfulness does that. So I think when people are writing letters, they're really engaging their heads, because they're using their hands as they're actually writing the script down, and that gives them that 3 or 4 or 5 minutes where they're really focused on the feelings that they're having for the other person, or the communication they're wanting to have with them. So there's the benefit there. And there's lots of, I think, we can share them in the presentation. I have a presentation that I can share with you, Martin, if you want afterwards, where there's other apps that are out there, like Headspace and Calm and Equilibrium and Sleepio, because at the moment, one thing during this lockdown is that structure in our day is becoming a little more confused. So people are going to bed later or getting up later, and the one thing is, sleep is absolutely vital. Everything else seems much worse if we don't sleep well. So having, and about a third of people have trouble sleeping, and over 60% of that third are women. And actually, I've consultant colleagues, that's what their specialty is. It's just sleep studies, trying to help people sleep, because it's so vital to our mental health. And like I said, that Appio, or that's Sleepio app, is good. It's been developed at the University College London, but there's lots of other lifestyle mechanisms you can use to help your sleep, whether it's just getting a structure in the evening of, eating a bit earlier, no caffeine, having a routine of getting into your cozy clothes from maybe your daily work clothes. At the moment, we're all lounging around, potentially in our tracksuits and various things. And I think it's important to delineate between the two, and having a warm bath and just having a routine that preparing for sleep, then not having bright screens in your room, being calm in the room, and then getting into bed about half an hour before. But then if you can't sleep, don't try and fight it. Get up again, read a book in another room, get a bit more tired, and then head back to sleep and aim for 6 to 8 hours and then give it a night. Lots of things we can do, but that's just recognition of one aspect of what's happening at the moment.
Yeah, it's very interesting that we're sort of talking there around solutions, and as you said, there's that distinction between the sort of burnout or the feeling a bit down, and the sort of things that are not as serious, and therefore the solutions are very basic things like the sleep, the diet, the exercise, and then as you mentioned, there are other levels where it gets more serious, and therefore there's probably more of an intervention needed to help to find those solutions. But so if we park the sort of solutions there for a second, when we look at almost like the kind of journey of addressing mental health, I mean, presumably it's always been there. Like as long as humans have been around, I would imagine there's always been these sort of difficulties and challenges around mental health, and maybe they are exacerbated as we've gone into industrialism and sort of the digital world. There maybe are additional factors, but I think for me, it's almost been the either lack of awareness that it's even a thing, but even when you become aware of it, there's always seemed to be a stigma. Like no one wants to admit that there is something around mental health that they need to address. It'd just be great to hear your thoughts on sort of over the time how mental health has been within society.
Yeah, I agree. So, when I was working in surgery and training to be a surgeon, I learning how to take out hips and knees. I only knew that the patient was sick when they came and told me that they couldn't walk as well as they used to be able to run, and they had pain in their knee. You get an X-ray or a scan, you'd see there's something wrong. You'd replace the hip. They'd mobilize with physiotherapy. They'd be great. They'd be running a marathon in a year's time. Absolutely fine. So it's like mental health should be, in my opinion, the exact same. As you've said, though, over the years and during industrialization, I think we sometimes prioritize what are, if you can't see mental health, then it's not there. So we become more involved in what our cultural pressures are to work. We have to make sure there's money for the family. We will educate and as individuals we're able to cope with problems and be solvers. And I think what happened was mental health became this symbol of not being able to cope with anything, as opposed to having very, very good mental health and being able to be smarter and cope with other stuff more. And what it became more like and evolved to be was just talk about it when it's a challenge and when there's something wrong. Then there was a stigma of talking about it. So if I talked about it and I was depressed or low, then I'm not able to do my job as well as I should be able to do it. Or I'll think my boss will think I'm not capable. And that starts probably in our 20s when we're trying to impress our managers and that we can do a good job and we're not deemed to be seen as compromising or weak, or that perception, and really comes from ourselves. And back in people in the last 100 years, people didn't want to talk about it also because it may mean institutionalization or things that would happen that was outside your control. So it's like, in Ireland back in the day, 50, 60, even only 60 years ago, Martin, all you needed was a local priest to say you were mad and you were sectioned and put into an institution.
Kind of see where some of that worry comes from then, yeah.
Yeah, exactly. So you could see, while it was more evolved and better in Great Britain, Northern Ireland, still had that fear factor. If a doctor or other people under the Mental Health Act felt that you weren't fit for work already, you would not be employed. The community might disassociate themselves from you. So it started with that. It came from a very, very negative place where you could openly talk about mental health. And the unfortunately of mental health is if you don't take care of it or is compromised and you try to ignore it, it will only become worse. And eventually your health will deteriorate physically and mentally. So I asked 20, 25 years, there was a recognition, even by some banks and senior corporations, that we needed to, it didn't really call it mental health, but we're like, we needed to make sure that the people that we have and train so much, so hard, have become healthy. So they'd be these team events and team bonding, and they were all much more about having a positive attitude at work. So, and that really is mental health, right? So it's like you need to have good mental health at work for it to be at home, and vice versa, and take care of it in both places. Now it's evolved even more that actually, how do we promote, be proactive of mental health? So, and how do managers talk about it? And I always say to managers, if you know your team, it's like having children. If you intuitively think there's something wrong, there is something wrong. And there is an approach one can take it with it, which is, we can get into the solution mode in a while, but, not diagnosing, not judging, and just having very open-ended questions, being very well aware of the resources that are available to your business or just in the community that you can point people towards, because you can't solve all the problems. But more often, it's important to have events like this week where you proactively engage in mental health. So interesting research shows the majority of CEOs in Silicon Valley and the West Coast are women. Over 65, 70% of those women are interviewed said that they spend at least between 8 and 10 hours a week taking care of their mental health via either exercise or meditation. And, they find that makes them more productive, happier in themselves, but clearly it makes them very smart people, because that's why they're the bosses of those huge organizations.
Yeah.
And if you go back and even look at some research that was done on mindfulness, which is just being in the moment and paying attention, Buddhist monks can practice mindfulness between 13 and 16 hours a day. And you and I don't have 13, 16 hours a day to promote mindfulness. But when you did CT scans of the Buddhist monks' brains, the hippocampus, the central locus of control for information at the base of our brain, was a third bigger than it would be the general population. So taking care of your mental health, well, before it was, oh, we just need to not get depressed, and it's good that we can talk about it, and if we share a problem, then it's halved. That's great. But now we're moving on to the ways in which suit you. If you proactively engage in your mental health, it just makes you a smarter, more content individual.
Yeah, that's really interesting. I was sort of also pondering, like, do you think there's a generational difference around mental health? And sort of, I hate putting labels and segmenting and dividing, but I guess my thought process is that older people, like my grandparents' age, it was always the stiff upper lip and just keep going and stay positive. And like you said, from that business report, it was more about how to keep positive. Whereas I feel like younger generations are a bit more open to just talking about the down days and the reality, in a way, that there are those days where you feel a bit tired. So there's a generational question, but I also wonder if there's a flow. Like, I know for me, there are times through a year or a day where I feel a bit more tired or a bit down, and it's not like depression, but it's like a lower mood, and we all get a bit freaked out. But I think if you let go and observe those sort of fluctuations, you don't feel as stressed by it, because you realize it's maybe even just a normal part of human nature. So yeah, be good to get your thoughts on the generational side and the cyclical side.
I think that you couldn't be more accurate. I think probably the generation of the like the 50, 65 year olds, probably just coming to terms with how much mental health is a major part of our lives. And yes, not trying to have that stiff upper lip and that I can forge through and get on with things. Everyone has that story of a grand aunt or grandparent who no one really talked to, or they were always wanted to be on their own. And when you ask them any history of mental health challenges in the family, they'd go, no, but there was this person, who, probably was overly dependent on certain substances, and, all that kind of thing. And we thought that they were a bit depressed. So, and because it is 1 in 4, 1 in 5 people in the world, from the smartest, it doesn't matter. There's no boundaries.
Doesn't discriminate. Yeah.
Doesn't discriminate. It's a global statistic. I think the other extreme, even to be a bit controversial, is that there is this generation. So let's say in the US, they were ahead of us. This generation now are in their teens and 20s, where everything's about mental health, and like especially adolescents who are thinking, I need to focus on mental health, or can't compromise my mental health all the time. So I need a therapist, etc., as opposed to being very proactive and taking care of their own mental health. So it's like gone to an extreme,
the other way.
and
Yeah.
there's about finding a bit of balance, and I think the balance is that your mental health, just because you're feeling a bit down, to your point, does not mean you have a mental health problem. So there's a very, very important difference between I'm a bit low, having a bad day, to now I've got depression, right? So that's a massive difference, and a big difference is time. So usually it's put it this way: if you're feeling a bit low and a bit difficult one day, it's probably because you're a very insightful, empathetic individual who you just basically notice your feelings, which also makes you a really good person at work because you're very conscientious, and you're empathetic to others, and you're probably a very good manager. So it's like that good stuff comes with some side effects, as it were, right? Because the intellect comes with a bit of baggage. That's absolutely normal. But
Sounds familiar.
yeah, so it's like you have to really just touchstone check for a second, feeling a bit low, but what am I doing later on? Oh, I'm going to have this for dinner because I really like this. It's like, okay, well, that means you're looking forward to something. So that's not depression then. That's like I'm a bit despondent of something at work, or even just sense check what went on for me this week that made me feel a little more disempowered, or made me feel a bit low, like I'm not being productive, or it's the end of the month and I'm waiting to get paid, or there's clearly a reason why it's just life seems a bit tough today. And then I always think what you do there then is you should check in at a mental health toolbox. So the toolbox is full of things you love to do all the time, whether that's drink your favorite coffee, go to the movies, do your sport, bit of exercise in a day, read a book, right? So you could make a list of them, like we're saying at the top of the conversation, write all those things down. And I would encourage people to talk later on about writing their values down, because it's really important that your values are most important to you, and that's the main thing. But write those things down, and they're the things you enjoy doing that make you feel a little bit more alive and upbeat. And when you're feeling that bit of a bad mood, you can say, yeah, I'm going to go and give myself a present and buy my favorite coffee and take a moment in 5-10 minutes and feel a bit better. Now, if you don't want to go near that toolbox for a few days, that's all right. But if you don't want to go near it for 2 to 3 weeks, then there's something else going on that's a little bit more sinister. So, I think you have to sense check why you're feeling the way you are on that day, why it's temporary, and also you're still realizing that you can still sleep, you still like certain foods, you still want to do a bit of exercise, you still access that toolbox. Okay, there's nothing to worry about then, as opposed to then the other extreme when you don't want to do any of those things.
Yeah. Do you think, like, because we always said before about we like to label, and labels have connotations that aren't always necessarily totally true of what it actually means. Like, would self-care, and even that can get twisted and moved as well. But when you talk about the toolbox and you talk about, the pillars of exercise and diet and sleep, it's that proactive stuff. It's sort of common sense self-care, isn't it?
Yeah, so emotional well-being and self-care are different things to different people. They absolutely should be. So, self-care for you might be going to the gym. If it is for you, then that's absolutely valid. That's what it is. But if you think about it, there's probably an awful lot we're doing proactively for our self-care that you don't even realize. But don't get too stressed about it. So, like, I often talk to patients and they're like, if I don't get to bed by 9:30 at night, I get really stressed. I don't get enough sleep. It's like, you're actually just really trying to take care of yourself. So if you're getting into bed by 10 and getting a good night's sleep, then that's really good. Try and spin it and be a bit more positive
And
about it.
don't stress because you're not in bed, because the stress is no good anyway, right?
It becomes counterproductive. So
Yeah.
it's like I'm getting stressed about not dealing with my stress. So it's like, there's that, and then probably the things like in diet that we can do. So very simple things like oily fish, quinoa, nuts, and pulses. Like they're all found by research to promote mental health. So, and dark chocolate. Who doesn't like a bit of chocolate? So that's helping yourself with that. The exercise piece, if you think about it, even when we're not exercising, we can help ourselves. So the New England Journal of Medicine and other journals have done research and show that if you just do 20 minutes of exercise 4 or more times a week, where it raises your heart rate by only 20%, that's as effective as a doctor prescribing you an antidepressant. So like that's a really easy way to self-care, where you're walking around the block or around your neighborhood for 20, 25 minutes in a given day. And you've just engaged in a major exercise of self-care. So I think one shouldn't put themselves under pressure that there is a Bible of self-care. There are a list of various things that you, through your development, are probably more aligned to or more interested in to help your self-care and the care of others, rather than actually adhere to a prescriptive list of what you have to do to care for yourself.
Yeah, it's almost that balance that routine is empowering, but then, yeah, there's a flexibility within the routine if there needs to be, because as you say, if you get stressed that you can't do the routine on a given day, it's counterproductive.
Yeah, there's just an acknowledgement that you're doing anything. Like, so if you're getting up in the morning, rather than, 2 or 3 nights a week, I rather say 2 or 3 nights rather than every night, because then people don't listen. You got to remember, 1 in 10 patients actually do what a doctor asks them to do. More often, patients don't do it. But like, not having your phone by your bed and leaving it down just in the kitchen, maybe a few nights a week, and using something else as an alarm. But also, when you're getting up first thing in the morning, don't immediately go to your emails and what's been coming in all night through the night. Give yourself 10 minutes for your having coffee or whatever, and just maybe watching a bit of news, or if you shouldn't be too engaged in the media all the time at the moment, because reading about COVID all the time is not good for our mental health. But having that time, that's just, and acknowledging that I gave myself that could be all you need to do for self-care. That's not very prescriptive. It's actually, you're proactively disengaged in all the things that are with you and taking it for the rest of the day. That's important.
Yeah, no, that's cool. I mean, I think for me, it's really important that our talk today is the general factors of mental health and the solutions, and obviously the work that you're doing in that space. And it's not like, and how is that relevant to disability, and how is that relevant to disability? Because it's just, as you said, it's relevant to everybody, regardless of disability or any other sort of identity, diversity and inclusion sort of agendas. But I mean, just to give a couple of thoughts from my side, because I've had a disability since I was born, it's always been difficult to exercise because my physical movement is very, very limited. And I definitely grew up, and this has nothing to do with my disability, but, my diet was a bit sort of crisps and fish fingers and chips type stuff. And so I think there was a lot of my growing up and in my 20s, and going out partying and drinking till the late hours, and it all accumulated in my early 30s. I'm mid 30s now. It was sort of 3-4 years ago that I couldn't go to. I just learned. I mean, I kind of had a mini burnout. It was, I just realized I was exhausted. My mood was affected. It didn't turn into the sort of weeks and weeks you discussed earlier of what you might label depression, but it was certainly not 100% health. And so I've gradually, got to bed a bit earlier. I've cut out caffeine after lunchtime. I'm quite fortunate. My fiance is a natural health practitioner, so she's just like plying me with the fishy oils you talked about, and I've taken out milk chocolate and just have a bit of dark chocolate. So very much just reasserting what you've been talking about from my very personal experience. But with the physical exercise, it's still something I am struggling with. But one thing I've got a hand bike that's motorized, so it does more of it because I physically can't move a hand bike that's got no motor. But while it's wearing around, I can still put in what I'm able to put in. But I've also just found that going around the block, particularly in COVID-19, I mean, I'd normally be jet setting around the world, giving talks and blogging about it this time of year, and I'm not going anywhere very far at the moment. But just to go around the block and the motion of my wheelchair on the cambers and just moving around, I feel so much better. And to your point about the social interaction, sometimes I think, there's another video call, but then I come off the video call buzzing because of that oxytocin that you talked about. And I think, just I want to make that point for disabled people watching, that there is always a way of a physical exercise, even if it is very adapted and personalized. And I also was quite self-aware a few years ago that I almost like, because I'm never going to run the 100 meters, why bother look after my body? And as I started to feel that sluggishness and that tiredness, I realized that I'm not going to be athletic because of my disability, but it's a whole other thing, that my diet and sleep and everything. And it's so obvious to say it now, but I realized it was almost a sort of self-sabotage in a weird way on a physical level. And so I just think that's quite an important experience for me to put out for the people watching, that however physically limited you may be, if that's the kind of disability a person has, there's still no excuse for not looking after yourself. And I mean, that's really one big point I wanted to make today anyway.
Yeah, that's really, really well made point. Like I talked a little bit about the heart rate going up and that helping, but there's so many other aspects of exercise that are really important for mental health. Just the feeling of achievement when you've gone around the block and you've been out there in the lovely sunshine at the moment, that you actually got out of the house and did something.
Yeah.
The fact that you might have waved at someone, said hello,
Yeah.
like it's rather than sitting inside. The fact that you're able to have a thought process that wasn't sat in front of the screen and working all the time.
Totally. Screen time. Wow. Yeah.
Yeah. So it's like, yeah, and even just the smells and the other senses being peaked as you're out there, it's different than sitting in our house. So like, and then and while people with disabilities, like I said, mental health doesn't discriminate, and we all have that as well. One thing you remember that people with disabilities do have, especially for those that have had it for many years and those who are born with it, in mental health and self-care, we talk a lot about resilience and how you build resilience and protect yourself. And that is with self-care. That is with all the things that we talked about. People with disabilities have often built themselves a very resilient network. It's something that facilitates them to have the life they want to have.
Yeah.
So they should be even more aware of how their bodies are feeling and how, what's required to help their mental health than other cohorts of the population. They're able to focus and maybe introspect a little bit more. So they might have a head start on that resilience. So if it feels to you in your mind you should be doing something, then you absolutely should be doing it. And the self-sabotage is absolutely normal as well, Martin. Like, we all go, I love a bit of sport and I've done my triathlons and running, but I'm never going to be an Olympic athlete. I'm like certainly not my age now. But the only reason I've ever done exercise from my teenage years was to help either control my weight, but also my mental health. It was just gave me such energy. The hardest part about exercise is getting to the gym or getting outside to do it. Once you're in it, like, you feel absolutely amazing.
And I think, the Paralympics has done so much for disabled people, like London 2012. It really put disability in the mainstream media more, and it showed that disability wasn't pity or charity or sympathy, but it was ability, and it was all the more positive side for the community. But one of the downside is that as an individual with a disability, but I think as a society, we see disability as Paralympians now. And, like you said, you do sport or you do exercise for your general well-being and for your mental health. But there was almost maybe how you said, the generational thing swung from one extreme to another. I think disabled people have faced that stereotype that we ought to be pulling our finger out and getting in the Paralympics next time.
Yeah, and you look at Paralympians now, and I've been in triathlons with the Paralympians. I've been in them, and like, I think if you do any sport and you're ever in the presence of a Paralympian, you realize how they are absolutely, there's just a professional sports person and they're miles apart of that. It's a completely different game, so it's certainly not pity and I don't know, people even should have had that perception, but it's like, I think they should be idols and icons to look up to for something they want to achieve.
Yeah, no, for
So
sure, for sure.
for all of us, and I often think as well, like even, and there's other disabilities. I do a lot of work with bariatric patients in order to prepare them and pre-qualify them for surgery. And obesity, it causes disability, causes problems with joints.
Yeah,
It causes um a debilitation and not being able to engage in certain things. But when I see someone who's out there doing 20-30 minutes walking, even though they're struggling with their obesity, like I just have so much respect for someone who's trying to do anything to help themselves. Like that's the key
yeah.
thing. Like, there should be no judgment. Everyone should, if you want to engage in something, you think it's important to you, then it's important, and that's it.
Yeah, no, that's amazing. Well, I think that we've really amazing sort of looking at some of the history of mental health in terms of how it is in society, and lots of ideas around solutions for people, which I think most importantly, the takeaway I've had from you is that, it's going to be individual, the solutions will be specific to the person, but equally it's about guiding people to be more self-aware and to how to create those solutions. I mean, one thing I've struggled to write a journal. I wanted to write a journal, but I just do a couple of days and then I forget, or I don't know what to put. And I mean, I'm a bit more out there with content and being a blogger. So I've literally started doing a daily podcast that is like a disabled founders journal. And it's on all the sort of podcast channels if anyone's interested. But I've found that for me, the orating and speaking is easier than typing. And so people watching maybe don't need to bother putting it as a podcast and having it as public. And of course, there's things I'm not going to put on it that are very, very, very private or personal. But most of it, it's just my everyday life. But it helped me to really be more self-aware and to get clarity of how the day went, what I learned, what was difficult, how I reacted to certain situations. So I think journaling is a very powerful thing. I don't know, have you got any experience of journaling as a
Yeah,
tool?
so journaling, and I think journaling, like you say, can be in a number of ways. Could be an audio note, it could be a blog, could be a tweet, could just be writing something, notes on your phone. It's
Yeah.
basically just about, it's like writing a list. When you're finding things difficult, if you write them down, it takes them out of your brain. So in cognitive behavioral therapy, for instance, that therapy works by, you have a particular mood, it affects your behavior. You change some of your behaviors, then it's meant to be alter your mood. So you'd say if you've negative thoughts and various things, write them down, put them on a bus and send them off somewhere. So it's
Mhm.
effectively just getting out what it's in your head, outside your head, so you feel like you have a little more control of what's happening. Journaling does that. It also, sharing some of your private sentiments with others has also been found to be very, to be positive, make you feel better. Someone that you trusted, friends and close family. And then, I think sometimes it's important to also list what is valid for you. So, if you take values like empathy, motivation, sense of humor, contribution, generosity, all of those, if you write down these values that you have, and then you can reflect on them. I mean, how was I generous today? How was I empathetic? All these things, that's also equally empowering. And I think employees can also do that. So if someone's feeling a little bit challenged at the moment, I think it's good for, in small businesses and large businesses, to take a bit of time, like to still have your one-to-one or a half an hour with someone to say, ring it up and go, how are you getting on? Open-ended questions. Don't necessarily have to talk about their private life, but it's difficult time for everyone. How are you finding? What's the challenge for you? Are you finding challenging? What solutions have you created? Because maybe I'll be able to share that with the rest of the team. So it's like acknowledging what's going on, and then saying if there is something challenging with the person, just letting them talk and listen. So uh, to your point, journaling is absolutely found and seen to be really powerful and important for people's mental health, or resilience building. Effectively, I
Yeah.
like to be more about not addressing a problem, but creating a better stream of consciousness. But also then have some managers out there have the control, have the ability to control how they're feeling, and how they may be able to manage someone's well-being. I think that's equally really important.
Yeah, no, that's great. Because I was about to say, like, there's a couple of other questions I'm really keen to ask you, but there's so much to discuss. I mean, I think, yeah, when we've touch base before this, that obviously I, like everyone, has been on that personal development journey, and gradually get more aware of things that need addressing, but get exposed to new tools and new solutions. And there's so much out there. We could talk all day about it, I'm sure. We've got a question from LinkedIn that I think is really good to answer. And then I want to just touch upon technology within. You talked a couple of apps already, but just a couple of thoughts about that. And then obviously what you're doing with businesses. I know you've been working with some big businesses. So we got about 15 minutes to get those three sort of topics to fit within that time. So first of all, the question from Anna: how do we support people close to us who have opened up about incapacitating anxiety and depression, but who are resilient to seeking support? So it's sort of not just for yourself, but how can we support others?
So I think probably, and I think it's a really good question, Anna. And you got to remember as well, people who do have a mental health challenge will be susceptible to even more mental health obstacles while they're going through this. So make very simple one first and foremost. If you're on medication or seeing a therapist, make sure you've got enough stock of your medication for the time being. Be proactive in getting your prescription rewritten and have the tablets you need at home. If you have a therapist, check in with them. So sometimes you don't realize, you start thinking, am I slipping? Am I going back to being very depressed and anxious again? Check in with your therapist or the health professional or your GP that you've worked with before, so they can say, I know you, Ian. Yes, I think that maybe you might need some weekly therapy now, or fortnightly therapy online or via phone. I think that you're doing really well, and there's no need to be paranoid about how things are going. You're actually doing fine. Check in with me again in X number of weeks. If someone is being resilient and they don't want to acknowledge that they're going through this, but you intuitively think that they are, then say maybe mirror some of what you do with them. So you can say, actually, look, I was feeling a bit low. I've been a bit anxious. This is what's been really useful for me. I don't know if you're feeling that way, but you might do this. So like various things, like, and structure it. So structure it under the, like, I always think of it in categories of cognitive, emotional, behavioral, and social. Okay, so cognitive, like, help them with a concentration. So maybe we do a crossword together today, or play a game, or try and interact with them while they're doing it. Or why don't you engage in some of the exercises like mindfulness that we've talked about, and we'll get onto the apps in a second. Emotional is like open-ended questions. You're asking them, how are you feeling emotionally? Have you been crying for no reason? Do you feel low mood or happy mood? And then you say, give them, again, if they don't want to answer the questions, then just go straight to solution mode. So it's like going, I think it would be really good today if we met for a walk, or you went for a walk. I'll check in with you later on. Or make your bed. Like, that's the first achievement of the day, right? So even just getting up, making your bed, and getting some structure into the house, and offering them the various solutions that we, like I said, the presentation will be available, but you can look on our website and see them as well. Encouraging them to use the apps we're going to talk about, but progressive muscle relaxation, other calming exercises. Education is really important too. What are you feeling? So have a list of all the symptoms of anxiety that we've discussed and there's many more. Look them up, and then have a list of all the ones that are depression. And if you ask the person what they're feeling and see if they check off against each other, then you can gauge maybe how significant this is for the person. So it's like, then if they don't want to engage with a mental health professional, which is often the case, they don't want to call anyone, or they don't even really want to talk with friends, then I think you need to almost sit down yourself and say, I'm going to offer this structure to them, or offer these ideas that might be helpful, and almost hopefully you're using them yourself. But if you're not, you're saying, I've used them and they're really good, and encourage them that way. And that's all you can do, really, as well, Martin. Like, it's important when a patient comes to see me, they want to be there. Doesn't necessarily mean they want to talk about everything, but they've engaged openly. Not everyone wants to engage, and you can only do as much as you're able to do to help someone and facilitate them against some of the structures I've suggested. And if they still don't want to help themselves or whoever else, then we need to come up with an alternative solution, something new to check in. We don't want to ignore them, but they need to help. They need to want to help themselves also.
Yeah, I won't say too much about, because it's a friend of mine, and yeah, I won't go into the details of their situation. But I think for me, it was taking the pressure off myself to solve and almost to be a savior. And as you say, you do lots of things and be there, even just to listen and just to be a friend, but not to feel you're failing or something negative on yourself when that person doesn't want to seek assistance.
Yeah, you just had a certain approach, and hopefully they'll listen. And tenacity, encourage them the odd time, even though they say
Yeah.
no, checking in the odd time. Don't leave it alone, unless they say so. Even find this with managers, like the open-ended and listening is really important, but having the tip at the tip of your tongue what the organization has in their resource bank to help the employees or is available out there um, is useful for you to know, but you can't as a manager fix everyone else's problem. You can
Mm.
only guide them to try and help themselves.
Yeah, and Anna said thanks, so that was
Okay, you're
well
welcome.
received, and thank you for commenting, Anna. Really good question. So yeah, apps, and then on to some of the more business side, and then we'll wrap up.
Yeah, so there's many apps like that are well researched. The one big challenge with our patients and people that we deal with all the time, have Martin, is there's so much out there. They
Mm,
don't know really what's useful, what's good and what's not. So there's a couple of things I'd recommend. So for mindfulness, John Kabat-Zinn, Kabutzin, is a very well established, renowned author on mindfulness, and he's written some really accessible books, and they're available as audibles, very useful for learning about mindfulness. There's one for mindfulness crash guide to depression. You don't necessarily need to be depressed at all. It's actually a bit of a misnomer title. It's
yeah,
very proactive in terms of like just helping your mental health resilience completely. Um, for Talk Happy is an app that you can use where it's a text app, so you can text bona fide supports, and sometimes people don't want to talk about them, they just want to write about them, and sometimes
mm,
writing is easier to communicate. That's useful. Mequilibrium is another one, which is gives you ways in which every week you check in with your very so it's an app that's been developed by University College London, SLEEPIO, and that's very helpful, specifically helping people sleep. Then there's Calm, CALM, is a good app as well, and equally another good app is Headspace. And then we've developed an app called Positive Occupational Wellbeing Resource, which is Power, which is effectively it gives you a score of how you're feeling and gives you advice about what might help you. And it's not just mental health; it might be trying to do a couch to 5K or do stuff on your diet or general well-being. So some of these apps, they're not just all about you and your mental health. They give you a well-being guideline,
yeah.
on guidance on how to do it. So they'd be definitely some of the ones that I'd recommend.
Brilliant. No, thank you for that. And I mean, it's safe to say that tech has brought more to the mental health party, if you like. There are lots of, you said, the apps. I mean, when I got into sort of bit more into my personal development journey, as I keep calling it, there was a lot of online courses that I found very useful, and I ended up going. There's a company called Mind Valley, and I went to some of their actual conferences in different countries. So it gave that social interaction that you talked about. In that sense, it was partly around my love of travel as well. But the speakers were anything from diet to exercise to spirituality. That was so many different things, but that was all via a lot of it was online. So yeah, I think tech's been good in that way. I'm sure we could also go on a tangent about the downside of tech and digital around mental health, and we're probably going to run out of time to go
Yeah.
in deep, but I think it's safe to say it's a double-edged sword, isn't it? There's a balance to it.
So, and and I'll say quickly on that, it's like, if you want to do something, or if you look at those resources, try something. And if you don't like it, it doesn't mean that it's not, you're not good enough to use it, or it's
Yeah,
not good enough. It just mightn't suit you. So it's
yeah,
like going to see a therapist. Sometimes you click with one, sometimes you don't, and you just have to find one that you click with. The other side of it is, we're not used to all the time. Like I'm not used to all the time talking to someone and seeing my face on the screen while I'm
It's
chatting
weird,
all the
isn't
time.
it?
So
I know.
yeah, so like we're doing all of that all the time now. So even that digital interaction sometimes is a challenge. It's not easy at all. So
Yeah.
and then constantly being on digital streams, taking a bit of time off to do the things we talked about is important as
Yeah.
well.
Yeah, obviously what we're doing, it's great because everyone can see both of us. But someone said on the more meeting stuff, it's maybe a good idea to turn the bit of you off because when you're having a conversation, you don't see yourself. So just
No.
maybe like do it on Zoom or Google Hangout so you can't see yourself. But I've also started taking good old fashioned phone calls a bit so I can go in the garden, in the fresh air, and I've not got to worry about looking at the screen intently as well.
Yeah, very good idea, I think.
Yeah. So I mean, really mentioned about the business. I think it's good to get a little insight into what you're doing for businesses, but then just anything you really want to end the chat for people to get in touch with you.
Yeah, so we're for businesses. There's a couple of things that we do. So we provide teams of therapists and doctors as well-being resources to corporations and small businesses, whereby their staff and they buy in Imagine Health Service, and their staff can avail of certain amount of sessions of support for well-being, whether that be they specifically have a psychological challenge, or they just want to talk about something to do with their confidence or esteem or building their resilience. And those sessions we provide them to via usually it's a link on the company's webpage, and they get seamlessly an appointment and the appointment can be face to face or VC by ourselves, and it's completely anonymous from the employer. The employers are just doing it to provide support for their people. From that, we can see trends and how certain companies are doing, and we develop generic training materials. So whereby they're PowerPoints and stuff about subjects that we've talked about today. What's the difference between bad mental health and bad mood? Or how do you build resilience? What is burnout? How do managers manage stress in their teams? Coping with COVID, like all of this stuff. So it's like, we do the research and development for the latest, insights that are coming out. So at the moment, an awful lot of a lot of coronavirus learnings from about quarantine and loneliness were researched in depth in 2004 out of Toronto when they had a SARS epidemic and they shut down their city, which I didn't really know about it, so I started researching it now. And there are a few other really good researchers like Hussein, which are publishing now in 2020 about loneliness and isolation. So what we do is we sum up all of that good stuff, the R&D, and we make it training, and then we provide some online apps as well to support organizations. So we do that, and we do that for large and small technology companies that want to do it or can afford to do it through insurers, but also we do it in some provide support for people with sometimes learning disabilities through NGOs by having psychologists go in and help if they're in residential care, Martin. They go in and work with the individuals one-to-one, but also with the teams who take care of them to give them behavior support plans that helps optimize the person's quality of life. So do stuff like that in NGOs work. Yeah, I'm really quite passionate about learning disability and that. I've done a lot of work with kids and even young offenders years ago who often had a learning disability and fell in trouble with the law. And so we do that for young people and adults now as well. And we do then some very niche stuff, which is forensic assessments because of the forensic psychology background, which is much more legal work. But sometimes there's crossover too, where unfortunately some people with learning disabilities, the law is not really built for them, and sometimes they make a mistake, and there's nowhere for the law to help them. So we try and facilitate that help.
Yeah.
So there's some of the bits and pieces that we're doing. But I would say in finishing up today, if there's any message to come from today is, really take 10-15 minutes to think about what's going to empower you and write out maybe what life is going to be like for you to feel empowered and better for the next 3 months, assuming with COVID, because there's never going to be like a lockdown turned off. This is going to be a phased approach back into our lifestyle. And that's even going to be difficult because people are going to be nervous, it's going to be anxious, it's going to be back out in the world, they're leaving their home, they're so used to it now. So maybe think about what that looks like for you with COVID, and then without COVID in 6 months, what do you want to achieve? And one thing I always think is useful, if think about, you know, where you were in 2015, doesn't seem like it was that long time ago, you know. So, and if you looked and wanted to write down what you wanted to achieve by 2020, then, you know, that would have been really cool. Kind of say I achieved it. So why don't we now look to 2025 and have a view of what would be important for you to have achieved in those 5 years, not just in your career professionally, but maybe personally. Like, do you, like you say, you love traveling. Does a person want to travel more? Do they want, what do they want to see? What kind of friendships do they want to grow? Do they want to have a relationship? Do they want to get a master's degree? Do they want to get a managing director role? Like, write down those things.
Yeah.
So like it just gives you the time and acknowledgement that you're taking time out for yourself. It's empowering you, but it's also giving you a sketch that, you know, I just don't have to think in the moment for the next 1 or 2 weeks and be stressed about what's going on with COVID. There's a much bigger life to be had, and we need to be optimistic about it.
Yeah, I was meant to get married next Friday in Poland, so I'm hoping by 2025 we might be able to do the wedding anyway.
Yeah, well, hopefully, good luck with that. You'll definitely do the wedding, for sure.
Listen, that's been a really, really interesting chatting. I mean, as I said a few times, I think we could have gone into all sorts of depth and other topics as well for the rest of the day. But yeah, very, very appreciative of your time and your expertise. If people, are there any sort of resources or web pages you've got that people can come to?
Yeah, so if you go to imaginehealth.co.uk or imaginehealth.ie, you'll see how to make contact with us, what kind of materials we've got there and resources.
Brilliant.
And we're on LinkedIn as well, of course, and you can follow us there. I'd be delighted to answer any queries. So we very much want to support people during this time.
Brilliant. Well, I'll if you send any other materials over as well afterwards, I'll pop them on the threads where this video is. So yeah, we'll get that to the people watching. We'll put some links down if there's any available as well. But yeah, brilliant. Thank you again, and lovely to meet you today.
Thank you very much, Martin. Delighted to be here. Take care of yourself.
And thanks for watching, everyone. I'll see you tomorrow, same time, same place, 12 noon. Weekdays for the last one of the week. We're already up to Friday again. So yeah, I hope you're having a lovely week, and I'll see you tomorrow. Bye-bye for now.